Okay, so if you're looking at spinal fusion surgery, you probably know there's one moment that causes a whole lot of anxiety, that very first car ride home. It's often painted as this unavoidable, really painful ordeal. But what if it didn't have to be? Let's dive in and see how we can completely reframe and reclaim that entire experience.
Now, here's what's really interesting. The worst, most miserable experiences, they're not just bad luck. And this quote, honestly, this is where everything changes. It tells us that the misery so many people are afraid of is actually preventable. And that, right there, is incredibly empowering news. And this is exactly what we're talking about. Your pain isn't some random thing happening to you. It's what we call a predictable collision. On one side, you've got your healing spine, which is super sensitive, right? And on the other, you've got a poorly planned trip. Think bumps, sudden stops, sharp turns. When those two collide, pain is pretty much the guaranteed result. But the key word here is predictable. And if it's predictable, well, that means it's manageable. So how do we actually manage it? Well, the first step is to completely change how we think about the pain itself. And this brings us to a really crucial shift in perspective, seeing the problem as mechanical, not just medical. This brings us to what we call the mechanical story. It's this powerful idea that your pain is being caused by actual physical forces from the car ride. The bumps, the turns, the braking that are acting directly on your surgical site. The pain isn't your body randomly failing you or your meds not working. Nope. It's a direct physical cause and effect thing.
Let's just compare these two mindsets for a second. The medication story is all reactive. You feel pain, then you take a pill. You're always a step behind, just chasing the pain, which honestly can make you feel pretty helpless. But the mechanical story, that's proactive. You anticipate those physical forces and you make a plan to minimize them. This is all about preventing the pain from spiking in the first place, which puts you firmly back in control. It's a total game changer, right? So if the problem is mechanical, then the solution has got to be mechanical too. And that brings us to our next section, building your very own proactive pain plan.
This is the big question, isn't it? How do you actually turn all this knowledge into a car ride that's way less painful? The answer is a simple but really powerful playbook, your proactive pain plan. And just to be clear, this isn't just about timing your medication. It's a complete strategy for the trip that gets right to the root of the problem, those mechanical causes of pain.
Now, a really good plan has to answer these three key questions before you even think about getting in the car. First, what is expected? You need to know that some soreness is totally normal, so you don't panic at the first twinge. Second, what is dangerous? This means knowing the red flag symptoms your doctor told you to watch out for. And third, and this is huge, what do I do before the ride? This is all your prep work, planning the smoothest route, setting up the vehicle with pillows, and even knowing how to use your own body to brace for bumps and turns.
Okay, so you've nailed it. You've mastered being a passenger. The next logical step is to get behind the wheel, right? Well, hold on a sec. It is absolutely vital to understand that for your recovering spine, these are two completely different worlds. And listen, this next part is so important, so please remember this. Just because you can comfortably ride as a passenger for, say, 30 minutes, that does not mean you're ready to drive for 30 minutes. It's honestly one of the most common recovery mistakes people make. And this table right here shows us exactly why. I mean, look at the difference. As a passenger, your core engagement is low, it's passive, you're just along for the ride. But as a driver, your core has to be actively engaged constantly. As a passenger, you can pretty much avoid twisting. As a driver, you have to twist to check your blind spots. And maybe most importantly, when there's a sudden movement, a passenger braces for it. A driver has to initiate it, slamming on the brakes, swerving the car. That is a much more demanding action on a spine that's still healing. So you see, by embracing this whole mechanical story and by creating your proactive plan, you get to change the entire narrative. Your post-surgery car ride stops being this terrifying thing to dread. It becomes what it always should have been, just another manageable, predictable step on your road to a full recovery. So with this new way of thinking, this new framework of control and preparation, let's end with a final thought. Instead of dreading that first ride home, let's look way beyond it. Now that you have a plan to get through it, what's the first trip you'll actually get to look forward to taking once you're healed?